Community Services, and I will be the moderator for our meeting this afternoon. On the agenda for today, you're going to hear from the mayor with an opening, and then you're going to hear a situational update from our public health department on our status. Afterwards, we're going to have a presentation so that we can all understand what the city is doing to keep everyone safe in this working environment. We've allowed for plenty of time for questions and answers afterwards. And so what we're asking is for people, if you have a question, you can either post it in the chat, or we're going to ask you to raise your hand so that we can make sure that we can get everyone's questions answered in the time period that we have. Right now, we currently have everyone on mute, and we will all remain on mute as our different presenters present, and then afterwards, we'll take the question and answer period. I do see the mayor. Mayor, welcome, and we are ready for your opening address.
Well, welcome everybody. We wanted to brief you on what's been happening with respect to the coronavirus in Nashua. And I want to thank Bobby Bagley, of course, for putting all this together, our risk department, and everybody else who's been working hard to keep us all as safe as we possibly can be. Now, as you probably have heard, there was several positive tests of people who work in City Hall, I being one of them. I learned from a coworker that the coworker's family member had tested positive, and that became evident last Thursday. So I immediately said, well, we should definitely get tested. So we did. I was tested on Thursday night. Of course, Bobby took care of that. And then the test result came back on Saturday, which was inconclusive. Although in speaking with Bobby about that, that usually means a positive. And so I was tested twice more on Sunday. Both of those tests came back positive. So, and since that time, there's been at least one other case. Now I think what does this tell us? I mean, I've been very cautious, and we need to continue to be very cautious around City Hall. I've not dined indoors at all, a few times outdoors, no group gatherings really whatsoever. But somehow this virus did slip through. Now, I think the chances of it happening the way it did were very, very low, but it did happen. So that says that we need to continue to be careful because we want everyone to be as safe as possible. Now, Bobby and others are going to outline for you the steps that we need to take, but still we need to keep City Hall partially or operating in the way we have. We're not going to reopen City Hall for quite some time, at least until the building is rebuilt. The appointment system seems to be working well, and there seems to be no outbreak or any cases related to the public coming into the building. But everyone should wear masks while in the building at all times. That was one thing that we relaxed in these small meetings. I had maybe a handful of meetings in the mayor's office, thinking that everybody the small number of people that would come in would be, of course, virus free, but maybe not. So we should have been wearing masks. We will from now on, and you should as well. So I just wanted to, my symptoms are improving. There's no question about it. And so, I feel fortunate that I did not get at least so far, a serious case. We know what can happen when people do get a serious case. We want all of you to be safe, your families to be safe. So we are taking the steps that Bobby will describe. And I think Flavia and others will back her up. Again, if you have questions or comments, well, we of course want to hear those later on. And with that, I will turn this back over to Bobby Bagley.
Great. Thank you, Mayor. And I do appreciate, Mayor, your making yourself vulnerable by sharing that information that shows true leadership, because it also gives us the opportunity to further our efforts in being vigilant around COVID-19 and around the metrics that we put in place to keep everyone safe. And so I do congratulate the mayor, not mayor that you got infected, but on the fact that you have shared this information with the folks that you work with. And like I said before, that does show true leadership. We wanted to take the opportunity to put this together, and in working with Kim Kleiner, Jen Deshays, and our office over at Public Health, take this time to provide information to our city employees so that folks will have a better understanding of what we're doing in our investigation and who we would call, why we would call them, and what we would do during that call. So we have Flavia Martin, who is one of our public health nurses, who is going to do a presentation on what our situation looks like currently, as well as what a case is, what we do with case investigation, what we do with our contact tracing, because we think that's very important for everyone to understand that information. Flavia?
Hello, everyone. I'm Flavia Martin, one of the public health nurses, and I'm the communicable disease program coordinator. I'm not sure who has control of the slides right now. There it is, somebody has it. So I'll just go through and explain what we've been doing. And I jumped in on this a little bit late. How are we doing questions? Are we going to be doing the chat function in order for people to ask questions? Okay.
So what we're going to do is we're going to go through the presentations first, and then we're going to have people provide their questions by either raising their hand or they can put them in the chat box. And then as people raise their hand, Flavia, I'll call on them or read their question from the chat.
Okay, perfect. So if we can forward the slide. Okay, so a general situational update. Mayor Donches was one of the 4 cases identified at Nashua City Hall. The first positive case that we identified was on Friday, the 4th. The second case came in over the weekend. On Monday, a letter was sent out to all City Hall staff notifying them of the confirmed case and steps to take from there. We identified the third case on Wednesday, and then the 4th case actually came in late last night. So we're up to 4 cases right now. These cases are described as a cluster. There will be another slide forward, which will say exactly what that means. Nope, let's go back. Thank you. So we'll talk more about that a little bit later. These cases are contained to a specific congregate activity that took place. These are not cases that are dispersed and multiple contacts everywhere. Right now we have 8 staff that are identified as close contacts, and additional personal close contacts outside of City Hall have been identified as well. All proper protocols are being followed in regards to disease investigation, contact identification, and monitoring and isolation and quarantine. At this time, we're not experiencing an outbreak. Like I mentioned, all the confirmed cases and contacts are confined to one activity. And public health will continue to monitor the situation and make appropriate recommendations as the situation evolves. So if it grows, if it stays the same, what's to come next, we'll continue to have that communication and make the proper recommendations. Next slide, please. Okay, a little background, transmission. The main way of transmission of COVID-19 is from person to person. Tiny particles of saliva or respiratory droplets from inside of our lungs, it gets released into the air when somebody coughs, sneezes, talks, yells, sings. So these little particles are coming from inside of us and gets released into the air, into our surrounding. So someone who is within that 6 feet close distance can inhale these particles, they can swallow it, it can land on their eyes, nose, mouth. And that's the main method of transmission. Another way is through indirect contact. And this is when these are through infected objects that we touch, and then we touch our eyes, nose, and mouth. So again, these respiratory droplets that are coming from inside of us can land in certain things around us. These items can remain infectious for a certain period of time, and then we touch those and then touch ourselves. The incubation period for coronavirus, for COVID-19 specifically, is 2 to 14 days from the time of that exposure. The median incubation, meaning most people get sick right around day 5 through 7, but it can start anywhere from day 2, or it can start at day 14. A confirmed case is a person that is confirmed by laboratory specimen to have COVID-19, regardless of whether they're experiencing symptoms or not, because we know that some people can be asymptomatic carriers and they can spread the virus without having, the classic symptoms of COVID-19. Next slide. So this is the process of our disease investigation. The confirmed cases will be contacted by a public health nurse, and we will be asking lots and lots of questions. First thing we want to determine is the symptom onset date, when somebody first became ill. We go back 48 hours from that first symptom to determine the infectious period. The infectious period starts at the 48-hour before onset, all the way through when that person goes into isolation and they can no longer infect somebody else. So if somebody is sick, doesn't come into, we'll just use workplace environment just because that's what we're dealing with. If somebody started feeling sick last night, today they call out sick and they don't go into work, then we're just looking at the 48-hour period from last night, and then not any time after that because they haven't exposed anybody else. If somebody goes in with mild symptoms and continues to work for 2 to 3 days before they get really bad and goes, uh-oh, there's something wrong, then that infectious period, we can be looking at a total of 5 days, the 2 days before, and then the 3 days that they went into work. And we ask them information about their contacts. 48 hours before symptom onset, what have they been doing? Where did they go? Who did they have contact with? Did they visit someone? Did they eat out? Who they met with? All those kinds of questions, so we can find out who were their close contacts during that infectious period. So someone who's a confirmed case gets placed on isolation, so they can no longer spread COVID-19 to other people. Typical length of time for isolation is 10 days after the symptom onset. So if somebody started to get sick on September 1st, their last day of isolation is going to be September 11th, because that's day 10. They can go back to work on the 12th. For someone who does not have any symptoms and is asymptomatic, that's 10 days from the date of the test swab. So if somebody gets swabbed on September 1st and they have no symptoms, they stay without symptoms, their last day of isolation will be on September 11th, because that's plus 10 days, and they can go back to work on September 12th. Next slide, please. So all the people that we identified as contacts through our disease investigation, they in turn get a phone call from us. They get notified of their exposure and their status as a close contact, and we advise them of their quarantine requirements. We recommend testing for them due to the close contact, and we maintain contact with those folks. We call them every couple of days, sometimes daily if needed, to check in on them and see how they're feeling. Couple of definitions here. A close contact is someone that was within closer than 6 feet to a confirmed case for 10 minutes or longer. And a household contact is someone that's living in the same household as a confirmed case. So what's not a close contact? If someone just stops by someone's office and stands at the door and chats with them for 2 to 3 minutes, that does not meet the definition of a close contact. walking by someone in the hallway that does not meet definition of close contact. So you need to have that contact for 10 or more minutes. And that's regardless of masking, because really we want to be very protective. Masking is, we strongly encourage masks. We have the mask ordinance in Nashua, and that's really to protect, it's source control. So if I'm infected, there's less particles coming out of my mouth and my nose in order to infect that person that was within close proximity of me. So chances are greater that they won't develop disease because, again, that protection that's standing right here. But when we conduct disease investigation, again, masking is protective, so that person is less likely to develop disease, but we don't consider that because we want to be maximally protective and break the cycle of infection. Next slide, please. Oh, that's my phone. Let me just mute that for a second. Perfect. Contact tracing. So so the people that are identified as close contact, they're placed on quarantine. Again, to break the cycle of infection, if somebody has been exposed, they may develop illness. So we don't want them being out in the community, spreading that and infecting others. Quarantine lasts for 14 days because that's the maximum incubation period. And that day will vary for close contacts versus household contacts. So for close contacts, that's 14 days after the last day of exposure. So if somebody was, again, I'm going to use the workplace because we're in the office. If Tuesday was that last contact, we go 2 Tuesdays from that, 14 days later, and then on Wednesday, someone may go back into work. For household contacts, it's a little bit different because when you're living with someone in the same household, that last day of isolation is only when the confirmed case is done. They can no longer infect someone. So for a household contact, it's a little bit longer than 14 days. Next slide. So I mentioned this is a cluster and not an outbreak, and I'm going to explain the difference. So a cluster, we define a cluster when there are 3 or more cases with a common link, such as a specific group, a team, a meeting, whatever, a classroom, within that 14-day incubation period. So I had mentioned that on Friday we had case number 1. Over the weekend we had case number 2. It didn't become a cluster until we had case number 3. And the little image there was borrowed from our school document, which shows a cluster 3 or plus cases with that one commonality. Typically there's a notification to the community, which that was done on Monday. And then the close contacts are notified by public health and asked to quarantine. Next slide. The difference between that and an outbreak is then when there are 3 or more cases who are not linked to that original group. So I'll go to the little image there where you have the 3 little red dots that participated in one specific activity. One of the little infected person goes and has a meeting, lunch, congregation with other people, and then the little yellow dots each go back into their own departments. And then if those outside people in other departments that are not part of that original group develop illness, that's when we call this an outbreak. And then further measures from what we apply to a cluster, we will apply a little bit more to an outbreak in order to, again, stop that chain of infection and transmission. Next slide. Personal prevention, things that we can all do as part of our community, as part of our workplace. Number 1, if you feel sick, stay home and schedule testing. You know, it used to be the days that we just pushed through because work needed to get done. So we would go in while congested and sore throat and not feeling good and taking Tylenol and ibuprofen. We can't do that. We can't afford to do that. We can't get our coworkers sick and keep propagating this illness. If somebody feels sick, they need to stay home. Practicing good personal hygiene, hand washing, hand sanitizing, not touching your eyes, noses, and mouth. These are major ports of entry for anything for COVID-19, for the flu, for colds and norovirus. These are our mucous membranes, and this is a major point of entry for illness. Maintaining social distance, and that's 6 feet or more as much as possible. So in public health, even when we're in our own office, oftentimes we attend remote meetings, so we're not congregating in one place. So that might be something that may be able to be instituted, or when you do have to attend close meetings, maintaining as furthest distance as possible. And ventilation plays a big part too. Opening windows, opening doors, running the HVAC, or when that's not possible, a HEPA filter also assists on that too. And always wear a face covering in public and when unable to maintain social distance. Again, when we're talking, when we're coughing, laughing, little tiny particles are just escaping from our lungs, from our throat, from our mouths. So by putting that barrier there, that's catching all those large particles that's coming from inside of us. And that really has a protective factor against the people close to us. Next slide. And testing. So if you have been exposed, anyone, or even if you haven't been exposed, in here specifically in Nashua, the public health department offers free testing every week if somebody just wants to know, or if someone thinks that they may have been exposed, experiencing any symptoms, even something mild as the sniffles, sore throat. We have the ability to test. So every Tuesday, 3 to 5 p.m. at the Elm Street parking garage, we have a newly created form so people can self-schedule by following that link. It's also available on the nashuanh.gov website or calling our hotline. There are additional testing sites throughout the state, and perhaps we can add a link to that afterwards to Convenient MD, Southern New Hampshire Medical Center, St. Joe's. These are all places that are offering community testing as well. Next slide. Oh, I think that's it for me.
Okay, thank you, Flavia.
Thank you.
And now with that said, I think, I know that we said that we would wait until the end. There are quite a few questions that are coming up in the chat. Kim and Jen, do you mind if we take a few questions before we go into the what the city is doing for safety?
No, certainly, Bobby. Let's take questions.
Okay. All right. So there were some questions that were already answered in the chat. And I have a few here. I think we've answered all of the questions that were pertinent to the part of what Flavia was presenting so far. Is there anyone that has a question that was not posted in the chat already that doesn't pertain to the second part of the presentation, which is what is the city doing to keep everyone safe? There's one question. Coworkers have been coming in with cold-like or sinus infection-like symptoms and still make it through the screening. Flavia, do you want to address that?
Sure. So any symptoms, I think the screening is on one of the slides. Can we forward to the slide with the screening questions? Right here, screening process questions. So where are you experiencing, the third bullet on the left, are you experiencing any respiratory symptoms, including a runny nose, sore throat, cough, and shortness of breath? So cold-like symptoms and sinus infection. So these are symptoms, these are typically symptoms of congestion, you know, the runny nose, the sore throat. So these people should be answering yes to this, and they should be screening out. They should not be coming in. So if they're being, I hate to use this word, but if they're being honest and answering yes, they should not be making through the screening. And that's part of the personal responsibility, that if we have symptoms, we should not be coming in because we're failing screening.
Thank you, Flavia. We have another question. Oh, I have a question. Who was notified on Monday? that all city employees were notified as stated. The email that went out, I do believe that email went out to all City Hall employees. Is that correct? I do believe that that did go out to all employees. I'm not sure if, I know we get inundated with emails, and so it may have been missed, but I do know that there was an email that went out to all City Hall employees regarding the cluster, because that email also recommended people to come over and get tested. So some people may have missed the that email. Yeah, the email, someone says, yes, the email came in on Monday afternoon. Okay. All right, now some of these other questions, Kim and Jen, do refer to the safety, what the City Hall doing. So does anyone have a question before we jump into that next section that has not put it in the chat? I don't see any hands.
Bobby, I just wanted to address one of the questions that I saw go by about allergy season and allergy symptoms.
Okay.
Because we get this from the school nurses a lot. You know, kids going to school classically have the runny noses and sore throat, coughs, and that kind of stuff. And it is allergy season. We're coming into cold and flu season, and there's really no way to tell what is what based on symptoms alone. So if someone does have chronic allergies that is managed by an antihistamine of some sort, that's just the nature of things. So take your medications and do all that. But if it's a new onset of, I have allergy symptoms today, but I didn't have it 2 days ago, that warrants staying home and getting a test and making sure it's a negative result.
Okay.
And that's the same advice that we give to school nurses and workplaces and such.
Okay, we have a question from Rich.
Jason Toohey asked us too, but sanitizing the building between the time periods and or afterwards during the event? Is the building obviously being sanitized nightly or daily?
Okay, that's one
You
of
want me
the
to take that
safety
one?
questions. Yeah, that's one of the safety
Yeah,
questions that
okay.
have come under that section.
Yeah, I'll address that when we get into my presentation.
Okay. And
If
I
that's
do,
okay with-
yeah, so Jen will answer that. I do see IT was not on the distribution list for the mail out, the email. Okay. All right. Kim and Jen, we're ready.
Jen?
All right. Kim, you want to switch the slide for me? Thank you. Good afternoon. Some of the information that you're going to hear from me may be repetitive to what you've already heard today or in the past, but this kind of information is important and worth repeating. So limiting face-to-face contact with others is the best way to reduce the spread of this virus. Socially distance whenever possible. Wear a face covering over your mouth and your nose. Otherwise, the face covering, it's not going to be effective. Wear a face covering in all common areas of City Hall, including upon entry of the building. Wear a face covering within your work area. Unless you're at your desk and able to socially distance at least 6 feet at all times from other people, you should be wearing a mask. Wear a mask when you get up from your desk and walk around your office. When maintenance, outside contractors, and IT are working within your area, regardless of the 6-foot rule, wear your mask. These individuals are walking around and maybe getting into areas that are not typical to where others go. This includes entering your space. If you can go into your office and close your door, then please do so. Next slide, please, Kim. Hygiene practices go hand in hand with wearing a face mask. Employees who share workstations need to sanitize at the beginning of their shift, frequently throughout the day, and at the end of their shift. Sanitize all equipment that's shared amongst staff, photocopiers, coffee makers, microwaves, lunch tables. Do not gather if one person can go to lunch at a time, or if you can stay 6 feet, because you aren't wearing your mask when you're at the lunch table. Sanitize the tables after you're done. Kim's going to talk in her slides about supplies and how to get them. If you're seeing that something's missing, let us know. A habit that we've now established in risk management is to leave our doors open so we're not all touching the doorknobs. I know that all departments can't do that, but if you can, a good rule of thumb, use hand sanitizer or wash your hands at least 20 seconds after touching anything that is shared. Next slide. So what is being done? Cleanings increased throughout City Hall: bathrooms, doorknobs, horizontal surfaces, stairway railings, conference rooms, the elevator, in common areas. Hand sanitizer for both staff and citizens. You're going to find it at the entrances, the exits, checkout locations, and other commonly used areas of City Hall. Patrons are only entering the building by appointment only. We have someone monitoring the back door, and there's signage throughout City Hall in order to keep patrons on the right path to where they're going. Patrons are being directed to use the 3rd floor bathroom only, and all other bathrooms are noted as for employees only. If you see something that you think may be an issue, hand sanitizer is out, signage is missing, let risk or building maintenance know so we can address it. Next slide. We've seen this slide already, the screening process questions. In the morning, everyone should be checking into the rotunda for a temperature check and reviewing these 7 questions. Make sure you're reviewing them daily, and it's important that you let them know if you're experiencing any of the symptoms. It becomes the norm and redundant when you go in, but it is important to answer these correctly in order to prevent passing along the viruses if you walk in with it. Next slide. The scanner that is being used to take your temperature is a temporal scanner. This scanner is one of the most accurate scanners on the market and takes your temperature 3,000 times per temperature check. It is important that the probe touches directly on your skin, so if necessary, be sure to move your hair back at your forehead and your neck for proper contact. You may not see it, but the probe of the scanner is cleaned with alcohol after each scan to make sure that it is safe for the next scan. If you answer yes to any of the questions, or if your temperature reads above 100.4, the temperature taker is going to screen you out and discreetly send you to the front of City Hall where you'll meet with me. My job is to answer any questions that you may have, ensure that the health screening was in compliance with the protocols that have been set, and to report confirmed screened out employees while working with the public health department, so we're all on the same page. There's always someone present in risk management office, so if you have a question or need assistance, please don't hesitate to stop by. We're more than willing to help, and if we don't have the answer, we usually know where to get it. That's all I have, and I'll pass it on to our next speaker, Kim Kleiner.
Thank you, Jen. And we want to thank Risk and Public Health for all of the hard work the past few days. Everybody has been working extremely hard. We want to go back a little bit. At the very beginning of the pandemic, working with emergency management and the Department of Public Health, put together procedures for supplying our city with PPE and cleaning supplies. A memo was sent out probably too long ago now for everyone to remember, but so we want to emphasize this again on the S drive for all City Hall departments. is a spreadsheet where you can request either PPE or cleaning supplies. If you enter your needs into that spreadsheet, risk or admin services will deliver the items if there's someone available, or call you to arrange pickup. So please, if you're out of masks, if you're out of cleaning wipes or disinfectant, gloves, if you need sneeze guards installed by building maintenance, or maybe you need thermometers for people that are not coming into City Hall every day, so they're not going through our checkpoint, and you want to arrange another way for them to be safe. Spray bottles. If you do not see something on that spreadsheet, please reach out to risk, reach out to purchasing. Additional items can be ordered by sending an email to COVID-19 orders or supply unit at nashuanh.gov. If you have a description of the item that you're looking for, or maybe a vendor and a certain purchase price, please let us know that and we'll get the item ordered. Down on our lower level of the building by our vending machines is hand sanitizer and wipe refills. These are the two items that we see employees go through the most, so we're restocking them there as needed. Some of you may know we have some City Hall building renovations that are coming up. So there were a few departments within City Hall that are requiring physical modifications in order to comply with CDC social distancing. Motor vehicles, tax, assessing, and the city clerk will all be modified. Work is going to be done in stages, with motor vehicle, tax, and assessing beginning first, and then the city clerk in November after the general election. Employees in these departments will either be working remotely or be reassigned to other departments. And you may have noticed this week that some of those employees were either reassigned, moved, or they have gone remote. That is due to the modifications within their department. Those modifications will start September 17th or 18th. All contractors that will be coming into our building will be screened daily. We will treat them as if we are treating any of our own employees. And they have a protocol that they have worked out with us and with the risk department for the COVID-19 pandemic, and we've approved that. Material during the renovations may be staged in some common areas. So you may see material either in the main rotunda or downstairs when you're going to the vending machines. So please just be careful of those items. We'll be giving additional information on whether employee access changes, whether we change the flow through the building, or prohibit access to different areas. And risk will be sending out emails, so please watch for those as they're available. For our employees that are working remotely, either by quarantine or physical modifications, or maybe you haven't come back to City Hall yet, there is a page that was sent out, an additional employee resource page that is dedicated to City Hall and city employees. That resource was shared earlier, and we'll share it again when we send out the link to this meeting for employees. That lists some easy ways to access your email when maybe you can't log into Citrix. It also gives you some information on benefits and human resources and how to contact IT. Of course, if you have technical issues, call the help desk or email helpdesk@nashuanh.gov. You can access your email by going through the city website and going to the bottom right of the front page of the website. We find often that sometimes that's the most one area that City Hall employees need to access the most. And if Citrix, for some reason, isn't working for you, or you just need fast access, that's generally a way to get it. The other thing that we've been asked quite frequently is email retention. This started back at the beginning of the pandemic. Your email generally expires within 45 days. But during this event, expiration has been extended to 90 days. And we know people are receiving a vast amount of email. And we wanted to make sure that people have the time to act upon those business emails that they receive. And I will turn it back over to Bobby, who's moderating the event, to see if there are additional questions. Bobby?
Okay, and yes, we have quite a few questions. All right, I want to go back. It looks like we had a question that Nina didn't get a chance to ask. Nina?
Hi, can you hear me?
Yes.
I have a question unrelated to City Hall. There is a town city ordinance mandating masks, correct?
Yes.
So there's no chance of getting any kind of enforcement, because a lot of times when I go to the grocery store specifically, and even at the pharmacy a few weeks ago, there are people with no masks and there's a sign saying that they're required, but we just can't enforce it, correct?
It can be enforced. It involves the police doing the enforcement with the business owner or the business manager. And so the protocol that we have right now and the way that the ordinance is written up is that if there is a breach of the ordinance, we do ask that people contact either the police or they contact public health, and then we refer that complaint to the police, and then they go and they do some education with that particular organization or that business, as well as there may be some follow-up from our staff from public health at that place as well.
Okay, because I mentioned it to my the grocery store, and they said they were a private business and they couldn't enforce it.
The way that our ordinance is written is that there can be enforcement.
So I would call the Nashua police and just tell them that I've seen people without masks at a certain location.
Yes.
All right, thank you.
All right, so Nick did clarify that IT is on the distribution list, but hidden. There was also a comment that if in the future, if the emails or notifications going out can be included in the body of the email and not just as an attachment, because it's hard to open up the attachments on the phone. And so it sounds like, you know, the email did go out, but some people missed the email for various reasons. Any other questions while I'm scrolling through here? There's a question, why was the email just limited to City Hall and not sent out to citywide users? And I'll have Flavia add on to this. When we're doing a case investigation, the folks that are notified are those who are at most risk for exposure or infection. And so there's not usually a notification made to everyone because they don't necessarily need to have that notification or that information. Again, once the cluster was identified, we notified those individuals that are part of that workplace so that they were aware. It wouldn't have gone out to all citywide individuals if they're not associated with the building. So Flavia, you could talk a little bit about how we do the notifications, even, you know, at schools or even at businesses. It's not generally a notification that goes out to everyone because we don't necessarily find that to be necessary. Flavia? Oh, I think she is frozen.
I believe so, Bobby.
Okay. And so that's, oh, there she is.
Okay, I was frozen. Everybody was frozen for a second there. Sorry. So yeah, part of the disease investigation process is that I try the best jogging everybody's memory of everyone who is a close contact. So everyone that participated in the specific activities, those were personally called, told of the exposure, and quarantined. And then the email goes out to the facility wide to notify those to be alert to self-monitor for signs and symptoms, like the images that I showed for a cluster versus an outbreak. You know, so there is always a chance that it can spread to an outbreak. So everyone should be self-monitoring. Everyone that wants a test should get tested, but those that were not at City Hall is not at any risk.
There's a question, why does wearing a mask in the building appear to be optional for some departments? Wearing a mask is not optional. We have an ordinance, and so the masks are supposed to be worn. And all of this is really going to be dependent upon each of our individual behaviors and all of us thinking about the other people that we work with. And so if we have that in place, we do want individuals to, follow that, the ordinance, because we have it in place, and just because we're all working together and we want to take care of each other's health. There's a question here, why hasn't plexiglass been put in place? It has been months and still no plexiglass.
So we would want to be alerted as to where that plexiglass is. We have installed it in many areas throughout City Hall. So please, if someone can email Jen and let her know where that plexiglass has not been installed, we'll put someone on it.
There is a comment about, and there were two comments about using the temperature as the only benchmark. And from our investigations with cases that have been positive, folks don't always have temperature. And so that's why those other screening questions are there. And again, Flavia can add on to this.
It always starts, oh, sorry, go ahead, Bobby, finish.
I was going to say, we do need for people to look at all of those questions and answer all of those questions to the best of their ability. If you have respiratory things related to allergies, then there could be a little bit of variance in how you think about, oh, did this just start? Is it worse than what it was? But everything else needs to be considered. We've had cases that have had all types of symptoms, and some of them have never had a temperature. Flavia?
Sure. So we've interviewed hundreds of people. Our number up to date, we've had in Nashua a total of 856 confirmed cases. We have a 93% recovery rate and thousands of contacts. So we've interviewed, we talked to a lot of people. It always starts with those non-specific symptoms. It starts with, not feeling good, the headache, the runny nose, the sore throat, muscle ache, those symptoms when you feel like you're getting a cold, you're just not feeling good. It starts like that with diarrhea, sometimes a little bit of nausea. It doesn't start with a fever. A fever comes on, but that's not the only benchmark. So for the folks who commented on that, absolutely right. The fever, that was one of the CDC guidelines, if you will. This has been, we've learned so much over the past 9 months since this first, was identified back in the end of December and January, that in the beginning, we thought it was just a fever, cough, and shortness of breath. And now we're at the point where we know a lot of people have loss of taste and smell, and food just tastes funny. Everything tastes funny. So we've identified all these other symptoms. So fever is not the benchmark for this. It's really those non-specific symptoms. You're feeling like you're coming down with something, that you should stay away, stay at home. So that's what I wanted to add.
And we've had people say things as simple as, I just felt off, right? And so that's a sign. It's not quite a symptom yet, but they just did not feel like themselves. And then it progressed to, I had a headache. I lost my sense of taste and smell. And some people it lasts for a day, and some people it lasts for weeks. I've investigated a case where the person lost their sense of taste and smell for months. And so these things can vary. We want to take into consideration that we do have community spread in our community, and the mitigations that we put in place with the masks, staying home if you're sick, if you're not feeling well, washing your hands frequently, not touching your face, your eyes, your nose, your mouth, wiping down surfaces when we know we're coming into a common area like a workplace. All of those things are very, very important for shutting this virus down. There is a question. Go
I see a
ahead.
question here that I wanted to answer is that, what if you have symptoms but test negative? Okay, so coronavirus, COVID-19 isn't the only thing that exists, right? We have allergies, we have colds, we have, so many other just viral illness that causes very similar symptoms. So we do encourage everyone with these non-specific symptoms to get tested. If you have a negative test, beautiful. The recommendation on that is you can return with a negative test, you can return to work 24 hours after being fever-free and you're feeling better. So not every sniffle, every cough is going to be COVID-19. Negative test, you may return to work 24 hours, fever-free and feeling better.
We have another question here about the public. Is the public being screened before they enter the building for their appointment? I know at our building, we had it set up that everyone got screened. Is that set up at City Hall?
No, so we have not been screening as far as taking the temperatures. Jen, I'm going to defer to you on the backdoor policy. Jen?
So if you're coming into work at City Hall as a contractor, you are being screened. You're being
No, I
screened right
think
at
they're
work.
talking about people that are coming in for motor vehicle appointments or assessing.
No, we are
appointments.
currently not screening anybody coming in for motor vehicle appointments. We are requiring anybody coming in for a motor vehicle appointment or any other scheduled appointment to be wearing a mask.
This says MVR. Is that motor vehicles? Has a few questions. Is MVR motor vehicles?
Yes, it is.
Okay. Has a few questions. Who was your representative from MVR?
How's it going? I'm actually in the office with everyone right here. So the thing with the screening is, no customers get screened. Can they hear me?
Yes.
Yes, we can.
Okay, no, because I'm muted on the TV. So no customers get screened. And the other thing is as far as like the customers coming in from the back door, we have an employee that checks everyone in, but I feel like it's too much freedom from that back door coming all the way to the floor, third floor. And sometimes people will just walk in and then take their mask off and then put it back on. By the time they get up here, sometimes they don't even put it back on. I've noticed that and seeing customers go, they'll get their registration and plates, and then they'll try to get in the city clerk or knock on the door or try to, they move around the building instead of going straight through. It's too much freedom, I think, as far as that.
So
Yeah, sorry, go ahead.
So if we may, so there have been a number of us that are monitoring the halls and looking throughout the halls at any given time. Certainly, if you are seeing or anyone is seeing people take off their masks, it's certainly fine to very politely say, I'm sorry, masks are required while in City Hall. I've certainly asked people that I've seen. I have to say that it's generally pretty rare that I've seen people When we did move motor vehicles to the auditorium, we installed the plexiglass. There may be, and if they are taking off their masks when they approach that plexiglass material, then certainly let us know. We can get signs up there and throughout City Hall reminding people that they must have their mask on. And it's probably not a bad idea. We'll put additional signage up.
Perfect. Thank you. The other question I had too was the traveling out of state and coming back, and is that still a mandatory quarantine for 14 days or?
Bobby?
Yes. According to the state's guidelines and what we've adopted is that if you travel out of state to any of the places that are outside of New England, when you return, you are on quarantine for 14 days. There is a
Perfect.
question here. Do we know definitely how long droplets can live on a hard surface? I do believe we have Ren Baldwin, who is our Deputy Health Officer, and Heidi Peak that are here. Ren?
Yes, hi everyone, this is Ren. Yeah, so some early research. Can you guys hear me?
Yes.
Yes, okay. So there was some early research that showed the virus living on different surfaces for different hours. So something like copper could be 4 hours. Other ones could be 24 hours, up to 3 days on certain plastics. The most important thing though about surfaces is thinking, what do we do afterwards, right? So we could have COVID everywhere, but as long as we're washing our hands afterwards, that's the most critical factor. So we need to reinforce the hand hygiene and then cleaning out surfaces earlier. And if it's okay, Bobby, I'm going to skip ahead because there's another EH question about using the department water filter and the coffee pot. Again, COVID is not a foodborne illness. It's not a drink illness. This is like respiratory illness. So again, the most important thing is maybe wiping down those frequently touched shared areas, such as the handle on that coffee pot, the handle on that water filter, and wiping those sections down. But as often as you all can, you just clean your hands as often as possible. Because even though we say to avoid touching our eyes, nose, and mouth, it's sometimes a unconscious habit. So if we get into the habit of using the hand sanitizer, washing our hands, we can mitigate those items that we're actually touching frequently.
Thank you, Ren.
Bobby, if you don't mind, just wanted to answer a few quick questions here that I saw come up. One is about, where is it? I think I have to go. So how accurate are the test results, both positive and negative? A positive result is pretty accurate, well into the high 90s. And that's because of the sensitivity, that there's, sensitivity and specificity. So the specificity is that the test is specific for this virus. So if it's a positive, it's a pretty darn good positive, like 98, 99% positive. Negatives aren't that high, is not in that high range. It's probably about in the 80s. So it really has to be taken into the circumstances if somebody has been exposed or not, or if somebody has absolutely no risk, no exposure, no nothing. But if it's a positive, it's a very high positive. The other one that I wanted to answer is the elevator safe and wipe down, or taking the stairs safer? Stairs are always safer just because it's a bigger space versus an elevator. Maybe somebody from City Hall who's taken care of the cleaning and wiping all of the common areas can answer about the frequency of the elevator. And the other one that I saw here that talks about, I have family who live in Florida and North Carolina visiting for a few days. So the out-of-state visitor out of New England states needs to quarantine. And the person who resides in New Hampshire who did not travel, they do not need to quarantine. And the reason for that is we don't quarantine a contact to another quarantine. So as long as a family member is not confirmed, is not symptomatic, the Nashua resident does not need to quarantine, but the visitors should. And that's it. Just want to knock those out.
All right. Let's see. You did the elevator. All right, and then there's a couple of comments here about, okay, so my colleagues and I would like to speak on this. Was that referring to the accuracy of the test, or was that referring to something else? That is Robert Durant.
Nope, so that was already answered, thank you.
Okay. Okay, so out of state, I was just trying to answer that question. So the state guidelines right now, they're looking at the states with the lowest number of positive percentage and cases as states where, in New England, where quarantine is not necessary if you traveled there. So Flavia did it out of the 6 New England states. Though where the quarantine is not necessary. And so and they're also looking at the epi data too. So places where those numbers are higher, there's a higher propensity of exposure. If you travel to certain states and you have to fly, or you're catching a train, you're doing some type of travel that's including a congregate or a large number of people, put you at higher risk because you're in a smaller space for a period of time. And then looking at the numbers of cases in those particular areas where you're going to. The reason for the quarantine after travel is to, again, make sure that we're not bringing more COVID into the state. So those states that are listed here from Flavia's response are the ones that have had the lowest number of cases, including New Hampshire, where quarantine is not recommended or not needed after 14 days. So it's travel outside of those states. I have sprayed and continue to spray the elevator, okay, throughout the day. What else? As a manager, can I require an employee that demonstrated cold, sinus, general illness symptoms with no fever to be tested? Where is HR? So HR is there. I will tell you, as the director in our building, I do make that recommendation for folks. I've also recommended that folks stay home when they know that they're sick with those symptoms. HR, can we require a person to be tested?
Hi, this is Larry Budrow here. That's not a question I think I should answer spontaneously.
Oh, okay.
Sorry.
The typical recommendation that we make to other businesses and schools and everything else is that we, in public health personally, we can't require anyone to get tested. We can strongly recommend it, but if they don't get tested and they have symptoms, they need to stay out for that 10 days of isolation period. If they get tested and it comes back negative, they can return sooner, but no test, and that's very specific, say, to schools, which is big right now. Another question that I saw here, if someone gets tested on Tuesday, should the person not return to the office until results come in? That depends on the reason they're getting tested. If they have been in contact with someone who's positive, they should not come in. If they have symptoms, they should not come in. If they're just getting tested just because they want to and have absolutely no symptoms, no risk factors, sure, they can come in.
Mm-hmm. And if they're getting tested because they were a contact to a positive, they actually should be on quarantine. So they shouldn't even be thinking about coming in. Building maintenance, okay. Yeah. What are our options if a coworker has cold-like symptoms and does not want to go home? Again, I have to go to HR for that, or to the mayor, or risk.
Oh. So it's a question, Bobby, they are having symptoms or they're portraying symptoms.
And they don't want to go home.
So if they're entering City Hall and they've gone through the screening process and they've answered honestly, they shouldn't be displaying symptoms then in their department. So I would recommend that when people are coming through the screening process in the morning, that we are being honest about any symptoms that we may be having, and exactly how we are feeling. Any concerns can always be reported to risk or to their supervisor.
Okay. If we ever have a vaccine, will all employees be required to get one? So that term required takes things to a higher level. Larry, Kim, or the mayor, there's some organizations, like some hospitals that may, and some nursing homes that may require people to get flu vaccine, or they have to wear a mask when they're working. I don't know what the requirement is for city employees if they are required to be vaccinated.
We do not require current vaccinations. And I guess from that, we'd have to investigate more and certainly see things, but you're not required to have a flu shot to enter City Hall, for instance.
What safeguards are in place to prevent those in isolation to entering City Hall after hours?
So there are very few employees within City Hall that have access to City Hall after hours. Most of the securities were changed during the pandemic when people went remote, and those securities being changed have gone through risk and been carefully determined. So that should be a very small group that are entering City Hall during non-business hours.
Okay. What if symptoms start to develop during their work shift? And again, this goes back to all of our personal behaviors, our fidelity and integrity. If we get sick while we're at work, or we start to exhibit symptoms while we are at work, we need to leave the workplace. That's what we're asking all of us to take personal responsibility in doing as we're working together. That we do that for each other. Will we be offering the flu shot? I just started to type the answer to that. Yes, we will be offering flu clinic for city employees. We are considering doing a mobile clinic, just as we've been doing with our COVID mobile drive-through testing. And so we are having conversations about that right now. There have to be plans that are written up for that. And the state is actually working on putting together plans for mobile vaccine clinics. That is what I'm hoping that we'll be doing with regards to our flu clinics. And so I don't believe that we're going to be inside offering flu clinics. Flavia, do you have any more to add to that from the nurses, from community health perspective? I mean,
Nope, other than we will be offering, yes, we will be purchasing the HR supply of vaccines and offering it to all city employees. Date TBD, to be determined.
Bobby, if I may, Bill McKinney. I believe there's a misconception among employees that fever is the primary indicator of COVID. And maybe, if possible, we could revise our guidance to really stress that any symptoms, including, cold-like symptoms, are a reason to stay home. We've been pushing that in our department as much as we can, but I still get the answer that, well, I kind of didn't feel well, but I didn't have any temperature. And I think really some adjustment in that guidance or re-education of our employees that fever isn't the key indicator. And if you're not feeling well, if you begin to feel well, stay home or go home. And no harm, no foul. Managers won't take offense to it. And we really want to make sure that, all team members are protected as best we can. And that seems to be a big misconception, that we're as managers dealing with employees when we encounter employees that are clearly indicating cold-like symptoms.
Thank you, Bill. And Nina just wants to confirm what she heard or read. If you were in City Hall prior to September 3rd, you needed to be worried about the exposure to this current cluster. So the question was asked was, what was the time period that we were looking at with regard to this particular cluster? So we looked at our first case. We looked at the last time the case was in the building, and we look at 48 hours, as Flavia mentioned, for exposure or for the infection period. And so we determined that to be 2 days prior to September 3rd. If you were called by one of us, that means that you were a person that was identified as a close contact. If you were not called by public health, you were not identified as a close contact. The only exposure that any of us will have to COVID-19 will be if we are identified as a close contact with someone who has tested positive and we've been with them for 10 minutes or longer in a very close setting of less than 6 feet from each other. Now, one of the other things that Flavia also mentioned was the fomites, or the objects that can be shared. So that's something to consider as well. So if you're sharing objects with an individual, and again, you would have been called as a close contact, then that would be a time that you would take into consideration or think about exposure to an individual. The investigation is ongoing. We are not done with our investigation because we continue to learn and gather new information. And as we gather and learn that information, we continue to extend our reach to individuals that have been identified by individuals that we are working with. Nina, does that answer your question? Okay.
And I
Flavia?
just wanted to add that the incubation period is up to 14 days, right? So we are almost halfway through right now. So there are certainly people that can still develop illness. It doesn't mean that it's infection control methods failed. It just means that people could be incubating this right now, and we will continue to follow it. So if anyone has any concerns, we'll be testing this coming Tuesday. Go online, fill out your self-scheduling form, come on down and get tested. If anyone has any non-specific symptoms, those, runny nose, sore throat, cough, muscle ache, pains, nausea, diarrhea, that kind of stuff, definitely come down because it may turn into an outbreak. We don't know at this point. We've identified that group, but there is always the potential to spread. And that's why we want to make everyone aware through, the general email. If you're concerned, definitely come get tested. It's the only way we'll find out.
Yeah. And I'm just putting our information here for the question. If there are any other, if we think we have some questions after this, who can we email? I'm putting in a response that you can call us on our hotline, and it depends on the question. If it's a question that's dealing with COVID, contact, disease, call us at our hotline at 589-3456. Ask to speak with a public health nurse. I'm putting my email and Flavia's email in here as well. If it's a question related to the safety in City Hall, you want to contact Jen Deshays or Kim Kleiner. If there's any other general questions, then you want to make sure that you contact your manager and speak with your manager specifically about those questions.
I see a question here. If City Hall has more cases, will we close again if this becomes an outbreak? That's certainly on the table. Okay, if we identify cases that are not connected to this original cluster and it starts popping up in different departments that were not involved at all, then that is certainly something that's on the table. We may have to close for 14 days, that whole incubation period, in order to stop the spread and get everybody healthy in order to return to work.
And those conversations will be held with the mayor and the senior leadership at the city with regards to that. So the mayor will make that decision on closing City Hall based on our recommendations if it comes to that point.
So Bobby, there's a question about, is a recording of this going to be available for employees? Yes, we have CTV creating a recording of this, which we will send out to all City Hall employees, and we can include a PDF of the slides if there's information in the slides that you'd like to review later, and the contacts at the end of the slides as well.
And there was one question about, did the hotline hours change? We did change Monday through Friday from 8 to 5 p.m. Now, with regards to testing, as Flavia mentioned, and I think there was a slide, we do offer testing for the public, which includes all city employees, every Tuesday from 3 to 5 p.m. at the Elm Street parking garage. You can register for testing by going onto our website under Public Health and Community Services. On the left-hand side, you'll see the menu, COVID-19. Click on that link. It takes you to the page where you'll see a box that you can click on to register, and you can register right online for testing on Tuesday. It is 2:16, so we're probably just a little over an hour. Are there other questions pertinent to the situation, our status update, and safety at City Hall, or even what the expectations are going forward? Okay, I don't see any hands, and I don't see any other questions in the chat. Did we answer your questions for right now? You can put it in the chat if you think so.
And we, so there was a question on, can we post the link to this on the internet instead? We can, there have been some employees that have asked us that are working remotely that we're not able to dial in today, and they were asked if it could be shared or the link could be shared through email, so we can always do both.
Okay. There's a question about mail. All right, I didn't see that one. Carrie, what is the question about mail? Is it
The
about?
question is, could the virus be spread via inter-office mail or US mail being delivered to different departments? I think that goes back to what Ren said, which is really important to wash the hands. There isn't a lot of data on it being spread that way through the processing and how long it sits and everything, but can somebody who's infectious hand it off to somebody else and they can catch it that way? If you're sanitizing, washing the hands and everything, there typically is not a high risk. The mail is not something we would consider a high risk source of transmission.
Okay. So if most of the questions that were pertinent and relevant were asked and answered, there's the key things that we want to leave with everyone here. We had this session or this meeting today because we really wanted to make sure we were attentive to the concerns of all city employees working in City Hall, and wanted to make sure that we were able to give this status update to help people understand where we are right now, why we've done what we've done up to this point, and what we will continue to do. So we have a cluster outbreak, as it was discussed earlier. We have identified all of the contacts thus far that have been reported to us and have been in contact with those folks. We've recommended testing for individuals, and we will continue this investigation. The information was shared to those who it was most relevant and important to get the information out to. That's why there was not a citywide notification made, because we did not find that that was necessary. Again, I applaud the mayor for being vulnerable and making his status known. And it's an important lesson that we all have learned, in that this virus does not discriminate. And we have to maintain our vigilance with our hand washing, with our mask use, with the wiping down our surfaces, and with the best integrity that we have with working with one another, in consideration that every action that we all take as individuals does not just impact us, but it impacts our families, our friends, and our coworkers. The mitigative measures that we talk about in public health, they are not expensive. They do require behavior change. They do require for us to do our due diligence with regards to the hand washing, with regards to the mask wearing, with regards to understanding that for those of us who are workaholics and think we have to be there, that there are a couple of days that we do not have to be at work if we do not feel well, that we stay home and work from home if we can. And if we can't, that we stay home. Flavia and myself and the nurses are doing all of the contact investigation, the contact tracing. If you are an individual who feel that you were exposed to COVID-19, please reach out and connect with us so that we can have that conversation. We can only reach out to those who we have information about. And so if there's something that we're missing, then we do need your help with that as well. At this point in time, there is no reason for City Hall to be closed, because we have a cluster outbreak that seems to be contained. We do not, we have a cluster. We do not have an outbreak at this point, based on the definition of how we define an outbreak. Okay. Thank you so much for joining us this afternoon. And again, you have our email contact, you have our phone number. Please do not hesitate to contact us if needed. Thank you, everyone. Thank you, Kim. Thank you, Jen. And thank you, Flavia.
Bye.